I would like to ask each of you to introduce yourself, tell us your name, your latest book, what you've been doing the last 20 years, just so we can get started, and then I'll go to questions. So maybe so we have an order to this, why don't we go, we'll go with Dr. Harris, then Dr. Lustig, then Dr. Yoho, and Dr. Abramson, just so in order. Dr. Harris, Dr. Lustig, Dr. Yoho, Dr. Abramson. I also want to just say for the record, each one of these doctors has their own opinion. Just because they are appearing on this panel does not mean that they agree with each other. They very well might, and they might say they do, but each doctor is speaking for themselves. They've had their own experiences, and even if they agree, one might feel stronger or less strong. So don't make the assumption that any of them are speaking for the other three. They are just speaking for themselves. Okay, so do you want to start us off, Dr. Harris?
Sure, yeah, just in 1 minute or less. So I'm a professor of orthopedic surgery based in Australia, and I co-wrote this book, Hypocrisy, How Doctors Are Betraying Their Oath, with Professor Rochelle Bookbinder, who's a professor of rheumatology and epidemiology. We're both academics, we're both clinicians, we see patients. Professor Bookbinder's in one of the top 1% of cited academics worldwide. We found, though, that in our practice, we don't like what we've been seeing. And so what we see is overtreatment, harmful treatment, and unnecessary care. And what surprised us is that this is sort of largely unknown, not only in the public, but amongst other doctors, our colleagues. So we wrote this book to bring attention to the fact that medical care, healthcare, and doctors in particular aren't really doing the best job they could. And we chose the Hippocratic Oath to highlight this. And when we looked at the Hippocratic Oath and read it, we thought, wow, this is a prescription of what we're not doing now and what we should be doing. And so we used each pledge of the Hippocratic Oath to create each of the 10 chapters of the book, and it kind of fitted very well.
Thank you.
Okay, so my name is Rob Lustig. I am a pediatric neuroendocrinologist. I'm clinically retired as of 5 years ago, but I still engage in research, policy, advocacy. I'm now also the chief medical officer of 4 startups and a paid advisor to 4 other startups. However, I do not take any money, and I've never taken any money from the food industry. I entered this through the back door. I was a pediatric endocrinologist. I went into pediatric endocrinology to take care of short kids, and then the short kids got fat on me. I treated them via the party line. You know, you eat too much, you exercise too little. And of course, none of my patients ever got better. And I started doing research in the field to try to figure out why kids with brain tumors became massively obese after their treatment. And I started realizing that the problem was not calories, the problem was insulin. And I started then looking at kids without brain tumors and said, you know, problem's still insulin. And then I started looking at adults and the problem's still insulin. And the question was, you know, what's wrong with people's insulin, and why do people need to produce 2 to 4 times the amount of insulin today than they did 50 years ago? And that led me to sugar. And that then led me to public health and to addiction and to metabolic syndrome and basically to advocacy. I have come to realize that doctors are not taught anything about nutrition. I learned nutrition in college. I majored in nutritional biochemistry in college. And then when I went to medical school, they basically told me to forget all that because that's not how you practice medicine. And I came to realize that we got it wrong, that food can be medicine, but food can also be poison. And that pharma, you know, for probably good intentions, only treats the symptoms of disease, not the actual disease itself. And so with these revelations, I said, there's a book here, and I've written a couple: Fat Chance, which was about diet and physical health; Hacking of the American Mind, which is about diet and behavioral health; and this one behind me called Metabolical, which basically takes to task the big food, big pharma, and big government in terms of fomenting our current healthcare crisis today.
Thank you. Dr. Yoho.
Thank you, and thanks for inviting me. So I'm 68 years old. I'm retired from medical practice, and I was actually a community cosmetic surgeon doing breast implants and liposuction and facelifts and that sort of thing. And my patients aged with me, and as we both got older, I realized they were being tortured by menopausal symptoms. And they were primarily women, 95% plus women. And I learned about how to administer bioidentical hormones, ultimately wrote a book called Hormone Secrets. And I talked about the problems with our current view of these things. We've had 60, 70, 80, 120 years experience with the various hormones. We've had 120 years clinical experience with thyroid. These things are the best drugs we've ever had. And they were being run down by an FDA that I didn't understand was completely corrupt at the start. So I got into that first and understood all the problems and the reasons why these hormones are being run down, because they were such effective drugs. They would certainly substitute for many statins and other things if they were cost effective and they were off patent, which they are off patent. So they have a hard time making a lot of money on them. So they run them all down with these black box warnings, which are fraudulent. And I step by step learned more and more about healthcare corruption. And I learned about insurance companies, I learned about the hospitals, and I learned about, Big Pharma. And I eventually wrote a synopsis of this. And actually, one of my intellectual mentors is in the virtual room. Dr. Abramson wrote some of the first material about this. And I read his books as part of my research at the very beginning. So this thing took me 3 years. The hormone book took me a year. And this Butchered by Healthcare is a summary of the bottom line about medical corruption, and it's ubiquitous. And I don't think you can tag the doctors as being the guilty parties. They are guilty, but we're all guilty. And in America, we spend twice what we do in any other country, and we get horrible results in terms of mortality and other markers. So, I can go on and on about that, but that's where I'm coming from.
Thank you. Dr. Abramson.
Yeah, thanks for having me here. And thank you, Dr. Yoho, for your kind words. 20 years ago, I left my family practice. I was teaching, I was a clinical instructor at Harvard, and had a family practice in a small town about an hour north of Boston. I had done a Robert Wood Johnson Fellowship after my residency and had research skills, but decided that my real calling was to go out and practice. And I enjoyed practice, and I was proud of the practice that I did. But as we opened the practice in 1982. As we got into the late 90s, it became clear that much of what I was reading and trusting and using as a basis to guide my practice in medical journals was becoming increasingly influenced by commercial goals. And Vioxx was an arthritis drug that came out in 1999. And the New England Journal of Medicine wrote or published the key study on Vioxx, which purported to claim that it was a safer drug than naproxen because it caused fewer GI symptoms. The study, as it was written in the New England Journal, neglected to include the fact that it doubled the risk of cardiovascular events and significantly increased the risk of heart attacks. The heart attacks were omitted from the primary data. And I became aware of this because the data that were presented to an advisory committee meeting in 2001 were posted on the internet. And when I found this trove of data, it just blew my mind that the New England Journal had published this article, that Vioxx was the most heavily marketed drug, that the drug reps were coming and harassing us all the time, and that my patients were demanding Vioxx, and I decided to leave practice and figure out what was going on. And in 2004, Overdosed America came out, and it did contain a lot of this Vioxx story. Vioxx was pulled a week after my book came out. It had very little to do with me. Another study showed that cardiovascular risk was doubled. And I had written about it, and it was very clear that Merck wasn't going to escape from this one. And they pulled the drug. So a week after my book came out, Vioxx was pulled, and I was the guy who wrote the last book. And suddenly I was all over TV and radio and got huge coverage. And lawyers found me and started to ask me to serve as an expert in national litigation. So I spent about 10 years, 11 years in national litigation for the plaintiffs. And in that role, got to see the actual corporate hard drives of the executives and the marketing people and the scientists and the interchange between them. And we could figure out what happened. I mean, I know what happened in a lot of cases, and in some of them I can talk about it. One of them, I was able to go to the FBI, or I was able to go to the FBI and the Department of Justice, and they subpoenaed me, and it turned into the biggest criminal fine in US history for any matter for false marketing about the arthritis drug Bextra. So I did litigation for 10 or 11 years. I learned a whole lot about what the drug company is doing wrong and how doctors can't possibly know what's going on. I learned that peer reviewers, we in the United States say that evidence-based medicine is based on peer-reviewed studies. The peer reviewers don't get to see the real data. The medical journal editors don't get to see the real data. The guidelines writers don't get to see the real data. And doctors, I think the sin that I see doctors being guilty of is that they are not curious enough to understand that they can't possibly know what the best way to treat their patients is when no one has access to the data. And as we talk, my biggest fix for all this is to make this data available in ways that doctors can access it so that they know what the true evidence shows. But as time went on with litigation, some money was changing hands. The plaintiffs won significant awards, but this knowledge problem was not getting straightened out at all. And even the biggest, most important trials were getting very little coverage in the press. And I decided that I needed to write another book and explain what's going on. It took me 6 years to write Sickening. And it just came out February 8th. It's wonderful to have it done. I've had a great run on podcasts, but I'm now entering another chapter and learning now how different the mainstream media coverage is of these critical ideas about pharma. And I'm getting very little coverage, virtually no coverage from mainstream media. Pharma has learned how to keep us out of the public consciousness. So now we've got another challenge. I know what's happening, and I wrote a book about what's happening, and publishing is a pretty free enterprise. But I don't know how we're going to help American doctors to understand that they can't possibly know how best to treat their patients. And this is a core problem in our healthcare system, which is now, if our age-adjusted mortality in the United States were equal to the average of 10 other comparable countries, 480,000 fewer Americans would be dying every year. And for this healthcare, and our healthy life expectancy has gone from 38th in the world in 2000 to 68th in the world in 2019, before the pandemic. And for this awful health and healthcare, we're paying an extra $1.5 trillion a year. So we've got, it's a match for the climate crisis in terms of the challenge to the democracy and our ongoing function as a country. And we've got to figure out how to do something about this.